Hello everyone, you're welcome back to my YouTube channel. In today's video, we'll be talking about 5 steps towards understanding and passing anatomy as a nursing student. If this is your first time of being on this channel, you're welcome to this channel. On this channel, we talk about everything nursing and nursing school journey, how to get the best out of your nursing school journey, to get the best of experiences. So this is a good time to tell you to like this video and also to subscribe to this channel so that you can join the community and of course be updated whenever a new video drops, because I'm sure there are so many contents that are coming up that will be of interest to you. And if you're a returning subscriber, you're welcome to my channel. Please do well to share this video to others who would be in need of videos and also in need of contents that this channel is going to be sharing and uploading with time. So now let's dive right into the video of today. Anatomy is a very fundamental part of the nursing education. It's very basic. It's something that you must come across. It's something that you must do. In fact, for you to say that you are a professional nurse, it means that you have a very good knowledge of anatomy. So it's not something you get to choose. It's not something you get to choose if you want to do it or not. It's something that you must do. And it's something that aside from doing it, you also have to pass. Because if you do not pass it, you're actually not going to move to the next phase, or it's going to be a stumbling block. And the interesting part of this anatomy is that it's not something you just get to study about in your beginning or in the early years. It's something you keep seeing. Aside from studying anatomy in your 200 level per se, or in 100 level for those who are in schools or nursing. Aside from that anatomy you get to learn that time in your early years, you also get to study the course called medical surgical nursing from your 200, your 300, your 400, sometimes even down to final year, because it's very trivial, it's very important to the nursing education. So now, how can you say that you're a nurse when you can't say what the body parts is? Now, this anatomy is the study of the human body. Basically, that's just what it means. It's just the study of the human body. And there are various branches. There is the gross anatomy, which talks about the human body generally in overview. There is the histology, which talks about the study of tissues. That's the microscopic aspect, the one you have to do with the microscope that your eyes cannot see. There's also embryology, which is also called developmental anatomy, which has to do with studying how an embryo is being formed and all. So anatomy is very important. It's very important to you as a nurse, because supposing a patient comes and then complains to you that, oh, I'm having pain here and there. Now, your knowledge of anatomy helps you to understand better the organs, the tissues, the system that is involved and affected, and what you can do, how to provide solution. It helps you have a better knowledge to know how to take care of a person, because when you understand a person's body, a person's system, you're able to take care of that person better than someone who would just do guesswork. So this video is going to let you know easy ways to understanding this anatomy and passing, because of course it's very important for you to pass whether you like it or not. So do well to listen very well. So the first step to understanding and passing anatomy is that you should have an open mind and believe that you can do it. Now, most of the time this anatomy comes up as being very difficult. Actually, it's difficult. I'm not going to pretend. It's actually difficult, and it's more difficult because the terminologies used in this particular course is not even English. It's more of ancient Greek and Latin words. So they begin to sound strange and foreign. You're like, oh, scapula, oh, axilla, oh, sagittal, oh, coronal. And you're like, you've never come across these words before, and you're wondering, what sort of English words are these? Most of the time, they are not English words. They are Latin and Greek. So it would come off as difficult. It's going to be a little bit difficult, and it might make you scared. You begin to think that you can't do this. But if the first step would be that you should have an open mind, that you're going to be great at it, and believing that you're going to do well at it. Because once you control your mind to believing this, you're one step ahead, such that when the difficulties come or when those difficult topics comes up, you already have this belief that yes, your mind and your brain would be able to accumulate every information and also be able to understand it very well. So yes, that is the first step. The second step would be that you should have a good study habit. Believe me, there is no passing anatomy, there is no understanding anatomy without having a good study habit. Without a good study habit, you're going to be so, you know, even if you attend lectures and or without a good study habit, you're not going to make the best out of it. So you need to be able to devote time towards studying his anatomy very well. The third step would be that you should attend classes, attend lectures frequently. It's very important for you to attend lectures because it's very possible that you could say, oh, let me stay back in my room or let me stay back somewhere and read. And when you read, you won't really understand it. So attending lectures will help you know the areas of interest to the lecturer. It will also help you know how to read that particular course, that particular topic at that point in time, due to the kind of emphasis the lecturer will place on some certain points. So when you've attended lectures, when you go back to your room, you're able to, read. And when you read, you're able to visualize, okay, yes, the lecturer mentioned this while in class, and then you're reading your textbook and you're seeing something similar or you're seeing the same thing. So it helps you flow easily. One other thing to add to your study habits would be to watch YouTube videos. I recommend watching YouTube videos because it helps to give you a visual explanation of what your textbook says. It helps to just visualize your textbook to you. So those things you must have seen, oh, the artery runs through from here to here, this part is medial to this. Now when you watch YouTube videos, you're able to see models, and then it's been explained to you in a way that you can easily understand. Because don't forget that this anatomy talks about sometimes the internal system, internal body, the parts that you can't even see. So this YouTube video helps to visualize these things that and helps your mind to understand this anatomy better. So the fourth step is to engage in discussion. Have a discussion group. Have a group of friends who are very much interested in understanding this concept like you. So the discussion group would help that each person would bring his or her own idea, his or her own opinion, his or her own way of understanding, because people have different ways of understanding a particular concept. So this person's understanding of it can help to make yours easier for you or help to break down those things you see as being so mountainous or so. So these discussion groups would help to make things easier. Everybody comes together, drops their opinion, explains it. It helps to break it down to the tiniest bits. It helps to break down complex concepts to the tiniest bit of it. So for this discussion, it's good to have people who have like minds as you. Don't just gather a group of people who do not know what they're doing or who are not really interested, because it's going to be so draining. Another thing you should ask your discussion group is that there should be room too for questions. With questions, it's easier for everybody to understand these concepts very well. So the fifth step, which is the last but not the least, is solving past questions. This is the step that solidifies all other steps, because it's very important that yes, as much as you're studying, you really want to pass your exams. Because if you just study, work hard, and your results are not in line, it makes your efforts to look so, useless, and it's really very frustrating. So because you want to pass your exams, it's very important that you add this step, which is to solve past questions. Solving past questions can never go out of style because it helps you to know and to understand the pattern of the lecturer involved. It could be that you're just assuming that the lecturer is going to ask only superficial questions, and then when you look back and look into the past questions, you get to see that the lecturer even went deep. The lecturer even went deeper into the concept of that course of this anatomy in particular. So it's very important for you to solve past questions. Solve past questions from about like 3 to 5 years before you down to your own set or down to your own year. So solving past questions are very, very important, and they can never run out of style. So if you watch this video up to this extent, I believe that you enjoy the video. So this is a point where I get to tell you to like, subscribe, and share this video to your friends, colleagues, and classmates who are also in this same level with you and are also having the difficulties and looking for solutions and clarity. Please do well to share this video to them so that they can also benefit from the content that this channel releases from time to time. Thank you, and see you in my next video.